start our meeting. There we go. So just ask that everybody keep your lines on mute here, but be aware of where your mute and unmute buttons are so that you can then jump in, ask any questions as needed. So first want to take a quick moment to say welcome back, everyone. It's been a couple of months since we've held the Pharmacy Innovators meeting live here at DocStation. That is mostly because we've been crazy busy. Lots of things to talk about and update you guys on, but also because we ultimately want to make sure that we're using your time wisely. We know that time is incredibly valuable, and we're very thankful for your partnerships and want to be able to always provide you useful content. So if we don't hold the Pharmacy Innovators meeting, it's because we can probably distill everything down to email, but we do like to check in on a regular basis here. So especially because we've launched a couple of new programs since our last meeting, some of you are joining Pharmacy Innovators for the first time. So welcome all of you. I'm really excited to have you here. What we do in our monthly Pharmacy Innovators meeting is kind of talk about the updates that are happening within DocStation. So they could be new to the whole platform, could be new to a program, new features that come across those kinds. And then especially really to have this community environment where you can chat with one another or ask questions of the DocStation team here so that you can utilize the tool to the best of your ability within your workflow. So that's truly our goal for DocStation. So for today's agenda, we've got some programs and leaderboard updates, product updates and tours, some program updates, and then we'll have an open discussion as well. So again, be aware of where your mute button is, as well as the chat bubble here in Zoom if you're connected online, and ask questions whenever they come up. All right, as we jump into it, I want to recall a feature that I've been sending out in our last couple of emails here. We do also like to feature someone or something about DocStation each month to keep you guys up to date on what's happening. So our feature for today is the pharmacy standard. This is the blog that DocStation utilizes and populates. It's hosted on Medium, and we keep a lot of really cool content there. So a number of our folks have contributed to that. Our CEO, our clinical systems analyst, our admin fellow, myself included, we've all kind of put together various articles on various topics. One of the fun things that we got to do not too long ago, earlier in this year, well, I guess it was a long time ago now that it's already the end of September. 2020 has disappeared, but we did get to meet together as a team back in February in Minneapolis, where we were able to meet some of our pharmacy partners as well as pharmacy contacts here in Minnesota. We were also able to produce mini bios for the whole team. So if you're interested in knowing part of the brains behind DocStation, there's little mini bios on all of us over there on the pharmacy standard. So feel free to check that out. We also have a lot of musicians in the group, so we do like to feature our music every once in a while as well. Kind of have something fun and different to look forward to. So kicking off with programs and our leaderboard. So this is a map of the current DocStation locations. So places across the country that have DocStation, are utilizing DocStation within their pharmacies. We're really excited to see this expand. For those of you who've been on board with us for a very long time, we started in that 7-state region from Montana and Wyoming over to Minnesota and Iowa, and now we've kind of branched out from there based on these various programs we're supporting. So thank you for those of you who have been with us long-standing, and welcome those of you who are brand new. I do have this list of programs that we're currently supporting right now, including our Blue Cross Blue Shield Northern Plains Alliance, or Clearstone. That's our original network. We're also supporting Blue Cross Blue Shield Minnesota, North Dakota Medicaid, OneRx, and BCBS Flip the Pharmacy. So we'll get into a little more detail on each of those later. But that program list continues to grow. We've got a lot of stuff happening in the pipeline, and I'm really excited to continue expanding our membership. We do also like to take a moment to give a shout out to our leaders. This is specific to the Clearstone program, Blue Cross NPA, and our task completion rate. So there are just a few hours left in the month. That will close at the end of the day today, but I am really excited to see such a huge list of pharmacies who are already at 100% task completion. So thank you so much, leaders, for all of the work that you put in and taking care of patients. Truly, task completion rate for us means meaningful interactions with patients. That means that you're taking care of those folks who have the greatest need, answering questions, providing those interventions, making sure that they are on the road to getting healthy and or staying healthy. So that's a very meaningful metric for us. We also like to touch base on the diabetes blood pressure at goal metric, which is also for our Clearstone program. These numbers have continued to increase over the life of the program. So very excited to see some pharmacies have 100% of their diabetes patients at goal blood pressure. So congratulations, Family Pharmacy and Colstrip Family Pharmacy. I believe those are both out of Montana. So thank you guys so much. Appreciate that partnership. And a new leaderboard statistic I wanted to share today was our pharmacist e-care plan. So those of you who are CPSN members, especially those who are participating in the Flip the Pharmacy cohorts 1 or 2, you regularly see these details, but we wanted to be able to kind of show some detail about what DocStation is doing to support you as well. So in all, we have submitted almost 6,000 e-care plans total. That's for the whole year of 2020. Again, for those of you who've been with us for a long time, you know that we did have care plans available for many of our pharmacies starting back in December of 2019 and moving forward from there. It was only more recently that we were actually validated by CPESN. So, more in a more official capacity, those numbers were being counted, but this number includes a number of those that were prior to that validation. As we comb through the details, we'll see that some of the most common encounter reasons are task related. So a big benefit of participating in a payer program on DocStation is that we automatically generate compliant e-care plans when you complete a task within that program. So a number of them are related to medrecs that you've done, immunization screening tasks, new medication and diabetes monitoring. Those are automatically popping up as part of the Clearstone project. So plans are being generated based on that. Another big chunk are those that are related to the Flip the Pharmacy program. So those are specific to hypertension medication reviews, also diabetes reviews, high-risk drug monitoring. It's a newer one that we had started supporting over the summer. So it's kind of neat to see those come together as well. And then separate of those, as pharmacists are utilizing the e-care plan feature sort of more on demand, so that's outside of a payer program, immunization administration is the one that we see most frequently. So it's pretty cool to kind of see these statistics lined up here. I will touch on it a little bit more later, but if you don't see your pharmacy name listed here and you expect to, because either you are a CPSN member or you do utilize our e-care plan feature, we're going to double check your integrations list, and I'll show you how to do that in a minute to make sure that we have all the records straight and on file here. So moving on to product updates and tours. And again, I'll remind you, if you have any questions about these details, either jump in and ask questions and know where your mute button is, or send us a chat bubble question. I will have an opportunity for you to speak up in just a moment here. So we had 2 really major product updates within the last few weeks. We have a brand new patient profile design as well as a new task workflow design. We're really excited about the functionality that this new design opens up for us in DocStation, and is really going to be able to accommodate a lot more information and some neat features on our roadmap coming up. So I just wanted to do a quick overview. We haven't had a live in-person Pharmacy Innovators meeting since this new design went live. It's now live for all of our pharmacy partners. So I do want to say a special shout out to those who beta tested it for us to begin with and gave us some great feedback. The new design is 100% based on feedback that we've received from our users for a long time here. So we're excited to be able to incorporate some of those new pieces that you really wanted to be able to see. The health record tab in the left navigation menu here is now kind of home base for all of the patient details. When you're on the summary page, you can scroll down and see all the details. Across the top navigation menu, you can look at each one of those tabs individually. So it's kind of a couple of different views depending on how you like to process information. You can also keep an eye on your patient profile demographics in the bottom left-hand corner at all times. So that was a specific piece of user feedback that we got. We want to be able to see the patient's date of birth and other demographics all the time across all of the views. So that was a great thing we were able to incorporate. And then we do have a new global add button. So in the top right-hand corner, you'll see that little blue plus. That's where you can add any new piece of information to the health record. So it includes anything from all of those tabs. And we also have, like I mentioned, the new task design for workflow as well. So all the same functionality is there. It may have just moved or look a little bit different. So in general, to start a task, that's pretty obvious. You just click the start button. If you want to snooze it, if you want to archive it because it's not relevant, there's a little context menu, the 3 dots on the far right side, and you can select that and choose which option you want there. So again, all that same functionality, just maybe moved around a little bit. This is a way for us, again, to be able to more easily and in a more streamlined format capture all of these details that we want to connect with. So related items within tasks, notes within tasks, being able to save them as public and private, all of those various things, as well as additional interventions and new cool workflows upcoming. So again, for all of our pharmacies who are integrated, who have the CPSN integration turned on, e-care plans will continue to generate automatically for you after the task is complete. Now, along with brand new updates, especially with designs, because things look very different, we've had a lot of support requests about various things. So there's a couple things I just wanted to touch base on in case you were also curious or feel like maybe you hadn't been able to ask the question yet. The most frequently asked question is, how do I add an immunization or a new medication during that task workflow? So that's a great question. So a couple of things that this screenshot points out for you, again, is that what feels very different now is because task workflow is happening in a drawer, is what we refer to it, you can easily minimize it and also navigate on the rest of the patient profile. Or actually, you don't have to minimize it. You can continue navigating on the left side all over the patient profile to look for things that you need. So that's very different from what our previous task workflow was. When it comes to adding immunizations or medications, if you don't see an option to do it right within that task workflow, in some cases it is. But if you don't see it, you can always minimize the task workflow, and from your health record tab, go back to that global add button and then be able to add in the medications or immunizations as needed. So it's kind of a handy way to be able to do both, kind of navigate all around while you're still in the middle of task workflow. All of our tasks now do also offer a save and close window as well. So if you are kind of partially working through things, if you get distracted by something, if you need to pause now and go take care of another issue, you can save the work that you've already accomplished there and come back to it later, or another person who's working on DocStation can pick it up from you there. So I'll go ahead and pause here and see if there are any questions, if anybody wants to make any comments about new designs, if there are other questions or things that I haven't touched on yet that you're still not sure how to utilize. I'll open the floor for a minute here.
There's actually a question in chat.
Excellent, Amanda, go ahead.
When a message is public versus private, who is public?
Excellent. Public is so that a note will transfer to any document that you generate. At this time, it's e-care plans. So if you save a note as public, you'll be able to display it on the patient printouts as well as the e-care plan. If you save it as private, it will not show up on those documents, but it is still available for anybody who has access to your DocStation platform to view. So that's the difference between public and private. Great question.
Awesome. I have a follow-up.
Mm-hmm.
Where can you free text directions for medications?
That is great. So that can be done within the medication file itself. So if you are, say from this view in the health record, you can click on the name of the medication and the drawer will pop open. And you'll see right in the middle is the instructions box. There is a little icon in the top right-hand corner of that instructions box with arrows that go back and forth this way. And that's the quickest, or that is the way to switch between the structured, sort of discrete data in terms of the instructions capturing that way. And then you can switch it to just the free text line. Really good question there. Any other questions? Any other thoughts anybody wants to pop in on? Excellent. All right, we'll keep moving forward. There will be additional time for discussion, of course, as we work towards the end of the presentation, but by all means, jump in if you have questions. All right, so I'm going to kind of move on to product tour. Another thing that we like to do during Pharmacy Innovators meeting is highlight a section of the platform or a tool that maybe doesn't get used as often or doesn't get looked at as often to help you remember what functionality is there and where you can kind of find various pieces of information. So today we're going to highlight the settings cog. On the far left-hand menu in that blue line you'll see there, the icon on the very bottom. For you, not in this screenshot because it's my view as an admin. You'll see the little settings cog. You can either click on it or you can hover over it, and you can edit the information that's within those settings menus. So within the profile, you can add in primary contact information. Now that's for your whole organization. So maybe a corporate address or a primary location address. You can review the members. Members are people who have access to your dashboard. Those are your users. And as you have probably seen in previous updates, we most recently enabled pharmacy admins to be able to invite and remove users of their own organization without having to check in with us about it first. So that's a handy piece you can do from the settings cog. You can also verify your integrations and your payments as well from that same area. So within locations, you can verify your integrations on the data exchange tab there. And that is the best place to know whether or not you have a live integration. So I'll touch on that in just a moment a little bit further as well. But this settings cog is a great place to make sure that your contact information is up to date. Primary contact in particular, those details are utilized for various things within DocStation on the administration side, so it's great to keep that up to date. We do like as much of the platform itself to be self-service for you as is possible, and I'll explain why that is in just a moment here. So, ta-da, the settings cog. All right, there we go. Next thing I want to touch on then are integrations. So we do, like I just said, like to make as many features available to be self-service within DocStation as possible. This is partly for convenience and mostly for security. We want you to have total control over the information and access to your DocStation dashboard as is possible. So pharmacy admins are required to enable a number of self-service integrations within the product for each individual location. So again, that settings cog, navigate down to locations, and then click within the location box that you're working on. If you are an organization with just one pharmacy location, you'll see that individual box. If you have many locations, there will be one for each. So especially for those who want to take advantage of our Pioneer RX integration, for those of you who are CPSN members, for those of you in Minnesota, North Dakota, and that list continues to grow for our immunization registry, that is the place where you can make sure that your integration is either enabled or you can select to enable it. A couple things I want to point out specifically. If the CPSN integration is not enabled for a specific location, again, location by location for you, e-care plans will not be auto-submitted to CPSN USA. This again is a security, mostly based on security for us. We want to make sure that you have control over your data. If you have not elected to send your e-care plans to CPSN, they will still be generated within the system, but they won't be auto-submitted to CPSN until you enable that integration for us. In the same place, should something change in the future and you want to disable any one of those integrations, you can do that from the same place as well. So it's pretty straightforward from that perspective.
Yeah.
And then I want to also,
oh, really?
Oops.
Yeah.
And then I also point out as well, within Pioneer RX, there's some additional information that happens within that integration. Once you click on that, you get a letter, piece of information that provides an endpoint URL, a username and password, and that information does need to go to Pioneer RX. You can submit that to them from a pharmacy support ticket. And we've got that situation pretty well ironed out there, and it's running really smoothly for a number of you, of our pharmacy partners here. But the data release form, which is linked here in this integrations page, is a requirement for that as well. Again, that's making sure that you are in full control of the data that you own within both systems. All right, any questions about integrations at all? Nothing just yet. All right, very good. And one more product tour piece I want to mention is the CSV upload. We've spent many months refining and defining this process, making sure that it runs very smoothly. So for those of you partners who are not able to access an integration or take advantage of one of those, we do have this really handy tool. If you can obtain a CSV file from other sources, whether it's your dispensing system or another clinical platform that you use, if you're working in a program that is managed by Excel files, those can very easily be converted into a CSV file, and you can upload that information in batches to DocStation. So it's very handy, and we've got a nice little help center article here to help you walk through that process. All right, we'll move on to program updates. So we're going to get into the nitty-gritty of a couple of our different programs here, starting with our Whole Patient Resources program. This is currently available to our beta group pharmacies in the Blue Cross Blue Shield and PA program. That's our Clearstone program. So the Whole Patient Wellness program is a way to provide our pharmacists a little bit more support as well as resources when managing the whole patient. These interventions are related to social determinants of health, things like transportation issues, caregiver support, food banks and grocery services, in-home chores, community classes and education, those kinds of things. There have been many studies done across the country where we have found that when a patient is lacking in one of these other categories, these social categories, it greatly impacts the cost of their medical care overall. So a number of payers have initiated programs whereby we can offer additional support, especially as a community pharmacist. You tend to have a lot more insight to how a patient is doing on a day-to-day basis than, say, a primary care provider might, since they only see their primary care providers a couple times a year. So you are uniquely positioned to be able to provide additional resources for these patients in these areas. And within the Clearstone program, we're now supporting a program whereby we can provide this information to you in a more streamlined fashion and be able to essentially give you additional support. So how the program works is within each one of the tasks, you'll see additional whole patient wellness interventions that you can select. So you select whichever one is a concern for you, and that triggers a series of notifications to the DocStation team and the Public Programs Resource Navigator at Clearstone. That's our buddy Jenny. Jenny takes great care of us and great care of our pharmacy partners here in providing additional details pertinent to whatever it was that the pharmacist selected within that task. So what we sent out to support this program a couple weeks ago was a survey whereby we can collect information about these resources in the various areas. Now, if you utilize them frequently, we can either refer them back to you or whatever the case may be if you call out to them, but especially kind of builds our resource library for pharmacies in your network as well. So we would love to have you, for those of you who haven't been able to respond to it, to click on that survey and be able to complete that. What we're looking for here really are ideas of if there are services like this that you recommend to your patients, if you know of food shelves or transportation services in your area, if you know about community education classes or places, websites specifically where folks can look those up. These types of things are what we're trying to collect for our resource library. So we'd love your input on that. All right, another program update for our Clearstone pharmacies that we're very excited for is our Safe Opioid Use Screening task. Now, a new communication went out about this just last week, and we got an enormous response about it. So I'm really excited for all of you who are looking forward to this new task. What we have launched is a task that is an assessment-based workflow that is based on the outstanding work of the OneRx project out of North Dakota. So all of these blue lines here are links to various information here, but this is an opt-in sort of program add-on for our Clearstone pharmacies. And the way we've designed it here is that pharmacies earn $20 per completed screening task. It's a great opportunity. Again, it is based on the OneRx project, but the task itself provides a specific workflow for you to help provide specialized care to patients on opioid prescriptions. The requirement for participating in this program add-on is to complete the 1Rx training. We do have more information now than we had last week about how that training is going to go. So please refer to the Help Center article here that I have linked. But essentially, there's just a quick registration program. The 1Rx program utilizes ceimpact.com to manage their program, or their program training resources rather. The pharmacist version is a 3-hour training program that offers 3 CE credits, and the technician program offers 2 CE training credits, is also 2 hours long there. So it's a great resource to be able to have a lot more training and education, understanding of best practices for how to manage this task. And then the tasks will generate for new opioid prescriptions following the opt-in for your location. So again, really excited for those of you who have already reached out to participate in this, especially those of you who are outside North Dakota. This is really exciting for the 1Rx program because they have up to this point been based only in North Dakota and have really wanted an opportunity to reach out beyond the state to offer these resources to other pharmacies. So really excited to be able to partner with them and with Clearstone to make this available for our Clearstone pharmacies. Along those lines there, we are going to have 2 informational sessions with the 1Rx project team. This is a great group of people. I highly recommend attending one of these information sessions. What you'll be able to do is really learn more about the program's successes, ask questions, get support from the administrators who really designed the program, and then also gain insight on best practices for providing this care. So we're going to offer these 2 informational sessions at varying times, October 8th at 2 p.m. and October 20th at 10:30 a.m. If you're interested in attending one of these information sessions, let us know by way of the chat, either here on Zoom, we'll take that down. After I send out this information as well, you can either email us or let us know on the chat on the website, the little blue chat bubble there. Just let us know which one you want to participate in and we'll forward the invite along. But again, really excited to be able to offer this program. For those of you who are in North Dakota and already participate in the 1Rx program, this will only augment what you're already doing for them or within that program. So there are some slight variations we can go into sort of on an as needed basis, but it will continue to support the work that you're already doing there. This is really just one step in the direction of the total 1Rx program support that DocStation intends to offer. So we're excited to be able to do this sort of one phase at a time, but eventually we will support the entire 1Rx program as well. We'll be their preferred vendor, platform vendor rather is the word that I was looking for. So excited for that and stay tuned for more updates for that in the future. Any questions or anything about the Safe Opioid Use Screening task or 1Rx? All right, are we ready to move forward, Amanda? I see you're getting some chat things, but I'm not sure if you want to.
Yes, we're good to move forward. Thanks, Aubrey.
All right, perfect. Thank you so much for manning that. Okay, next program update is for Blue Cross Blue Shield of Minnesota. So welcome those of you who are here for this program specifically. Really excited to have you on board. This program focuses on adherence, medication synchronization, and statin use in diabetes specifically. As you've probably seen, we've sent out a few communication pieces. We are aiming to impact STAR measures even yet before the end of the year. We're reaching to these extreme goals, and we just love doing that in DocStation, really being able to make the impact there. So because of that, this program is time sensitive. We'd love it if you can jump into DocStation as quickly as possible on a regular basis. Keep an eye out for these tasks. The sooner you can interact with them and provide those interventions, the sooner it makes that impact, obviously for the patient, but also for your STAR measures. So check in frequently, check in as often as you can to address these tasks as quickly as possible. Very excited again to have you guys on board. All of our Minnesota pharmacies are currently participating in this automatically. So for those of you who started with DocStation in the Clearstone program, now also have the opportunity to participate in Blue Cross Minnesota. Some of you are just in Blue Cross Minnesota as well, and we continue to grow and expand from there. So we're really looking forward to continuing this program into the new year when we'll have additional details for what program participation there looks like. So thanks for being with us.
Aubrey, I have a question in chat.
Absolutely.
We may have people that use Blue Cross Blue Shield of Minnesota and South Dakota. Will we see any of these?
Yes, we do actually. And if I can put Max on the spot, and we can check in with Max, who is our admin fellow and has been doing the largest amount of recruiting for Blue Cross Minnesota. Max, how are you? Good to see you.
Good to see you too.
Thanks for joining Pharmacy Innovators. How would you like to answer that question about South Dakota?
I can validate many pharmacies outside of the state of Minnesota who still have Blue Cross Minnesota patients have been added already to the program. Austin, I can validate that the program has been added for your pharmacy. If there's anyone else on the call who thinks that they have Blue Cross Minnesota pharmacies that they take care of their patients for, just drop a message in the chat box and I can just validate that you were included on the list of pharmacies added to that program.
Excellent. Thanks, Max. Appreciate you being here as well, partnering with us.
Thank you.
For those of you who haven't had the opportunity to meet Max Andrade, Max is our pharmacy admin fellow. Really excited to have him here at DocStation. He just recently started. He is a pharmacist who's been all over the place, various places, and is fresh off the residency tour. We're very excited to have his knowledge and expertise with us. If he looks a little familiar, it's because he's Simon's twin. I know a lot of people have been in meetings like, wait a minute, you look familiar, but I don't recognize your name. So very glad to have you on board with us, Max. Appreciate you being here.
Thank you guys, appreciate it.
All right, moving forward. One more program update for CPSN USA and Flip the Pharmacy. So we know that cohort 2 for the Flip the Pharmacy transformation program just started this month, or I guess is kicking off tomorrow. Really excited for any of you who are joining us for that and participating in that. DocStation can support your practice transformation in a number of ways. Like we've mentioned before, we do have a level 2 validated e-care plan. We have monthly workflow webinars, which have moved. They were previously on the 4th Wednesday. Now they're going to be on the 2nd Wednesday, 10 a.m. Central. You can register by clicking on that link there if you'd like to do that. And we also have various other change package support tools as well. So as CPSN changes things and requires new things of their members, especially in this Flip the Pharmacy program, DocStation will also continue to change and flex so that you're well supported for that. So again, for those of our pharmacy partners who are with us here specifically for e-care plans, really glad to have you there. If you have any questions or concerns about how you utilize DocStation within your workflow, please let us know and we will be sure to take care of you. All right, at this point, I just wanted to open it up for discussion. We always want to, again, foster this community environment. Those of you who are on the front lines know the most about how DocStation is working in your pharmacy. So we just want to prompt with a few questions. If anybody has anything to share at this time, I'll open the floor. I do have a couple of questions to sort of prompt discussion at this point, but if there are any other topics you'd like to discuss, everything is available at this time. Any questions or concerns? You might have an easy day for it this time, which is great. A couple of things that we definitely want to continue gathering feedback are specifically related to new designs and features. We want to know how you want to learn about product updates. So we do our best to make sure you're well informed. All of our Help Center articles are updated on a regular basis. We are on top of the chat. We can answer your questions in less than 5 minutes usually, but we want to make sure you're well equipped for those changes. Amanda?
We have a request from chat.
Yeah.
Can you just give a little synopsis on what the Pioneer integration offers?
Absolutely, that is a great question. So Pioneer RX integration, which is live for a number of our partners, is focused on the RX events API currently. So what Pioneer RX makes available is information that comes based on your prescription dispensing data. What DocStation does as we ingest that information is we're able to better populate your patient profiles. So for those of you who have enabled this integration or are thinking about it, the ways you can think about it are for the programs that you're working on specifically, whether it's Clearstone or Blue Cross Minnesota. For the existing patients on DocStation, their profiles will be a little bit more filled out because any prescription dispensing information you have in Pioneer Rx will transfer into the profile on DocStation, namely the instructions, which is also important. We know that's a big data entry piece that we are not always able to get from claims data. So that certainly helps when it comes to immunization screening tasks and MedRec tasks, as well as new medication tasks. All of that information is automatically populated for you. Another great benefit for it is that the integration is not limited to just those patients who are already on DocStation. It will include your entire patient population that you have in Pioneer Rx. The handy piece about that is that you can then use DocStation tools to manage care for those patients as well. So when we go back to that sort of blue global add button in the top corner, you can very quickly use DocStation as truly your EHR. So when you're having interventions and conversations with your patients there, you can document them in DocStation. If you don't happen to utilize Pioneer Rx's eCare Plan feature, you can use DocStations, which is again always free to use and is validated with CPSN to capture and document, again, your interventions, but also report them to CPSN. So that is the current extent of the integration. It is based on prescription data. If there are other pieces of information that you would like to see populated in DocStation, we would love to have that feedback. We're not the experts, you are. So let us know what you want to see and we will be able to ask those questions and hopefully expand that integration so that it is as useful as possible for you. One more thing I will say that it is just a one-way integration. So information flows out of Pioneer Rx and into DocStation, but it does not yet go the other direction. One day when we all take over the world, it'll do that. But for now, it's a one-way integration. All right, any other questions, Amanda?
We have some feedback from the chat. Kyle says that the Pioneer integration is pretty awesome, but otherwise we have no other questions.
Okay, fantastic. Thanks, Kyle. I'm glad to hear that. I know you've been waiting probably almost the longest, but that's good. I was just reminded there was actually one slide that we accidentally skipped over here. So I'm gonna kind of run back. I think it's a little bit slower before we close out. I apologize. Thanks for bearing with me. Oop, there it is. The settings cog, the help center. So one more piece that I wanted to touch base on product tour. I've referred to the help center a number of times here. So for those of you who aren't familiar, we have a very extensive, comprehensive help center library with articles of information for basically every feature and piece on DocStation. If you have questions about how something works, how you're supposed to address a task, what the purpose is for it, what the details of a payment program are, all of that information can be housed at the Help Center. You can find it at help.docstation.co, or you can find it by clicking on the blue chat bubble in the bottom right-hand corner of the platform there. Like I mentioned before, help articles are regularly updated to support new features, designs, and programs. So especially as now we've transitioned to a new task workflow, if you feel like there's still something we haven't talked about here or questions that haven't been answered, I'd highly encourage you check out whatever pertinent task article is listed over in the Help Center for additional questions on there. The most frequently asked question or concern we get about this is that you're unable to access the articles. That is because most of our articles are only visible when you're logged into DocStation. That is, again, more of like from the safety perspective for us, is to make sure that that information is readily available to our users and not necessarily readily available to those who may not need it. So if you have concerns, if you click on a link that we send you and it says this link doesn't exist, try logging into DocStation and just click on it again. You'll be able to see that information. Okay, but yes, the Help Center, I'm gonna plug that Help Center all the time. It's full of great information. And if you just can't find what you're looking for, or if you prefer to just ask, by all means, click that chat bubble and let us know. All right, I think that's all that I've got for you guys today. Unless there are any other questions, I'll give you a few minutes back on your calendar. Anything else, Amanda, you wanna touch base on from the chat box?
No, we're all good.
Excellent. All right, any last questions or comments or concerns? All right. Sounds great. Thanks for being with us, everybody. Hope you enjoy the rest of your day. Get those tasks addressed for those of you in payer programs, and we'll see you next month. Thanks so much. Take care.